Thank you for being here with us tonight. I'm Todd Coons.
And I'm Bree Clark. Hospitals in eastern Idaho are seeing patients from not only the regional area, but Montana and Wyoming as well.
Local News 8 reporter Adrian Luevano is live tonight for us with more of what Idaho hospitals are telling the governor.
Yeah, Todd, the Medical Advisory Committee in Idaho sent out this letter to Governor Brad Little expressing their concern over the state's rising numbers. And here in East Idaho, hospitals are having their own challenges dealing with those rising numbers.
We've had several instances where we had utilized all of our ventilators that we have in place.
Idaho Falls Community Hospital COO Casey Jackman said in a public meeting that his hospital is filling up with COVID-19 patients. They acquired 2 ventilators from FEMA to bring their total to 10. In the past 2 weeks, there was a time where they were using 9 out of 10 ventilators.
But we have had a couple of times in the ICU where we did not have enough staffing to be able to handle some patients. And luckily, I was able to send those over to Eastern Idaho Regional Medical Center, and they were able to keep those patients here in this area. But I'm sure that put an additional strain on them.
Staffing is an issue for all hospitals, including IRMAC. IRMAC has hired 10 ICU nurses because they are getting more patients from eastern Idaho area hospitals, plus hospitals in Montana and Wyoming.
We hope going into the winter time we're in a much better situation. Right now we are managing well, but still very tight. So just wanting to keep our folks healthy and happy and not burnt out.
For Madison Memorial, they currently have 3 COVID-19 patients in their hospital. They had to transfer a patient overnight on Tuesday to Idaho Falls to get special care due to staffing.
I had a conversation with a patient this week making a comment of, well, how come you don't just hire more nurses? And I was explaining to her that a nurse isn't a nurse. Basically, you have different physicians with different specialties. You have different nurses with different specialties.
Still Memorial in Salmon has had a challenging 2 weeks due to increasing numbers. And sometimes they have trouble transporting patients due to oxygen needs.
This past week, we've transferred out 10 patients. We are seeing in our emergency department an average of probably 4 to 5 COVID patients a day. And when you have a core nursing staff of 1 ED nurse and 1 ED doctor, it's extremely challenging.
With winter around the corner, the hospitals say they want a mask mandate in place so they can have a fighting chance against the virus in the Gem State. In Idaho Falls, I'm Adrian Luevano. Back to you in the studio.
Thanks, Adrian. Now, we did reach out to Bingham Memorial Hospital in Blackfoot and Portneuf Medical Center in Pocatello. They did not get back to us for comment.